about the new Pro?
With the new Pro, it is a big step forward in pulse dye laser technology. It has numerous advantages compared to what we've used in the past. Most importantly, it has very reliable output. So it's a technical thing from the physician's perspective, but from the patient's perspective and the outcome, it's giving us much more consistent results in terms of what we're providing to the patient. So it has a larger spot size, so the treatments are faster, which is particularly helpful for the children. So we can go up to 15 millimeters with the spot size compared to the older pulse dye lasers, which went to 12, but it was very hard to treat at 12 millimeter spot because there wasn't much energy. This laser has 50% more energy than what it had in the past. So more energy, larger spot size, and more reliability. So when I visited Candela to see the laser about a year ago, they showed me a graph that showed the pulse-to-pulse variability, and there was very little variability, which was different than what we had seen in the past. So on a technical basis, what happens with the older pulse dye lasers is that the dye in the pulse dye laser degrades over time, and that makes the treatments a little bit less reliable. Also, there are lots of internal changes, which makes the optics and the energy output just much more consistent. And this has real consequences. And the real consequences, I think, are better outcomes, more comfortable treatments. It also uses a different approach to cooling. So where we've used the dynamic cooling, that's the spray that's used prior to each laser zap, it also delivers that spray after each laser pulse. So not only do you have a treatment that's faster, more consistent, but it's also less uncomfortable. It's a better overall experience, let's put it that way.
When you premiered it at our super clinic in October, there was a man who had not had treatment in like 15 years, and he said it didn't even hurt, and you didn't even use numbing cream. So are you...
Well, I can't say that it's painless.
Not painless.
But it's less pain.
Less pain.
Less painful.
Less painful.
So this has particular benefit for the children. I mean, one of my goals over the years is to minimize procedures that are done under anesthesia, particularly for the young children. So I think, number one, that carries a little bit of risk. Two, it's a much more of an ordeal. And three, it's a lot more expensive. So, we want to minimize all of those things. There's also that FDA concern about repetitive exposure to general anesthetics under the age of 3. So if you can get a lot of these treatments done or perform more effectively and more completely before the age of 3, that makes a very big difference in terms of minimizing risks and just making an overall better experience.